Welcome to Healthy Births, Happy Babies, where we share tips, tools, and stories grounded in natural childbirth and parenting principles, so that instead of feeling overwhelmed and confused during this exciting time in your life, you feel safe, supported, and empowered in your childbirth and parenting journey. And now, here's your host, Dr. Jay Warren.
Hello, and welcome back to another episode of Healthy Births, Happy Babies. I'm Dr. Jay Warren. I'm the Family Wellness Chiropractor and the Wellness Care Coordinator here at the CAP Wellness Center. And in today's episode, we're going to have a conversation with our very own Higa. She's the acupuncturist here at the CAP Wellness Center, and she's going to explain a little more about a series of acupuncture treatments which has been come to be known here as Baby Boost. It can help labor along, doesn't necessarily induce labor by any means, but if a woman has been getting ready for pregnancy, wants to help it along, and especially if they've gone past their guest date and wanting to make sure things are ripe and ready for our body to go into labor, then this series of treatments has proven very helpful. But before I'm going to introduce and bring her on, I want to take a moment, as always, to thank our sponsor, the CAP Wellness Center, who makes this podcast possible for us. The CAP Wellness Center in Encinitas, California, has assembled an incredible team of fully certified holistic healthcare professionals that offer the very best in prenatal, postpartum, and pediatric wellness services. We offer acupuncture, chiropractic, massage, yoga, lactation support services, and a wide variety of birth education classes to ensure that you are fully able to experience the power of birth. So now let me introduce to you Higa. She was on one of our earlier episodes around acupuncture and fertility, but just to remind you of who she is and what she's about, let me tell you a little bit more about her. Natural medicine has always been an integral part of Maring's personal journey. She has studied extensively in the area of fertility, pregnancy, and postpartum recovery. In 2005, Maring traveled to Chengdu, China, to an intern with some of the best gynecological doctors in the world. Maring has specialized in treating male infertility, female infertility, and pregnancy support for the past 6 years and continues to study the most up-to-date information in the field. Maring's personal experience of having a difficult pregnancy and then suffering with postpartum depression has made it natural for her to empathize with women going through these very difficult times. Combined with a Master's of Science from Pacific College of Oriental Medicine and a psychology degree from Naropa University, Maring has created a truly integrative, compassionate, and heart-centered approach to healthcare. When Maring is not in the clinic, she spends her time playing with her son and her daughter, teaching and performing aerial skills, playing music, enjoying the outdoors, and writing. So with that, let me turn over to my conversation with Higa. Hello, Maring. Welcome back to the podcast.
Hi. So nice to be here again.
Yeah, well, it's great to have you back. It's been actually a while since we did your other episode on fertility and acupuncture, and today we're going to be talking about Baby Boost. Fertility, obviously, we're wanting to help women get pregnant, and now Baby Boost is kind of a topic that's usually coming up towards the end of the pregnancy, trying to help labor along, and there's a lot of different misconceptions of what it is and exactly how it works, so that's why I want to bring you on, so our listeners could really understand what it is that you do and how it could help them.
Awesome. Yeah. Thank you. Yeah. It's been really great. So I've specialized in this field for almost now, I think like 7 or 8 years. And originally when I learned about like quote unquote Baby Boost, a lot of times people think of it as like the last ditch effort. I'm 40 weeks. I need to get this baby out. Like I'm going to go see an acupuncturist. And what's really been great since working at CAP Wellness Center and seeing almost, I would say like 90% of my practice is pregnant women, and having kind of the gamut of people that come to me who are like 40 weeks and they want their baby out versus doing some education and really seeing that since we see women earlier, seeing the difference between people coming in earlier in their pregnancy and getting prepped for having their baby is the results are so much better, and people actually are seeing results. I kind of joke around and call myself the closer sometimes when I'm being sent the mom who is 40 weeks and she's, done being pregnant and, wants that baby out. And I'm like, I'll do my best. And we kind of make this valiant effort. And sometimes it works effectively at that point. But I've just found over time that when I see moms, at the earliest, in their second trimester and all the way through, those moms, when it's time to be 40 weeks and they want to really, get things going, we do, quote unquote, a baby boost treatment. And that really seems to be more effective. My numbers go up in terms of efficacy when I've seen a mom longer than, say, 1 or 2 treatments.
And is the baby boost a series of of treatments, or is it just one set of stimulating certain points?
So a baby boost treatment is, or series, I would say it's more of a series of treatments. And I recommend that people come in around 32 weeks in their pregnancy, 1 time a week, until we get a little bit closer to 39, 40 weeks, and then have them come in more frequently. And it's called a baby boost series because acupuncture works very similarly to how you might think going to the gym might be. So if you want to lose 5 pounds, you don't go to the gym 1 time in a month. You're going to go consecutively over time. And as you go more and more, it tends to get more easy because your body starts to respond quicker to what's happening, your muscles building and all that. So we call it a baby boost. This is sort of coined from Cap Wellness Center series because we're not just the misconception, I guess, in that word is that it is helping to, boost, in essence, the process of going into labor, but it's also to help prep mom and help prep baby for delivery. And the other thing that's great about the Baby Boost series is that I've also seen a difference between postpartum and women who are coming in regularly towards the end of their pregnancy and prepping for labor, for a healthy birth experience, healthy labor. And then their postpartum experience tends to be a lot more neutral, I should say. I don't see kind of these erratic, experiences after people have had acupuncture through the series. And that's just my own personal research, or, it's not like documented or anything, but that's just what I've seen from seeing so many women come through my practice, that their postpartum tends to be a lot easier.
Right. And that's important because I think some women will definitely have the impression that a baby boost is like, if you can induce me tonight, I'd love to have my baby tomorrow. And that's not at all what this is.
No, I wish for these women, because I've been there, I've had 2 babies. My first was 2 weeks post due. So I wish that for their sakes that I could do that. And sometimes, I do have that random experience where they've seen me 1 time and then they go into labor that night. So I wouldn't say it's for naught, but I've just seen if there is a choice and there is a preference and you have the time, that it's best to come in, 32 weeks or even sooner.
Right. And can you explain how that process is working as far as the Baby Boost series, instead of thinking of, okay, these are these points, these acupuncture points that I can needle to then just start labor artificially in the same way that, an artificial drug, a Pitocin, would initiate labor?
Yeah. So we're doing a number of things when we're starting to prep for labor. One is just increasing blood flow and prepping the cervix to ripen and dilate. When we get a little bit closer to the end of pregnancy, we're actually helping along those Braxton Hicks to become a little bit more productive. So we're helping with that hormonal transition, but we're also doing a lot to calm the brain and calm the mind to help prep for going into delivery. Whether you're doing natural childbirth or whether you're actually planning to have a C-section, getting those endorphins kicking in the body can also help with the efficacy of the medication working more effectively. It can help with putting yourself in that kind of state of mind when you are actually in labor. So, the research definitely supports being calmer in labor and having better birth experiences. So acupuncture is just, getting that going from the very get-go. 32 weeks, we're like pumping in those endorphins, those pain relieving, storage. I call it a storage, where you're storing them up so that when you're actually in labor and you're having, surges or pain or whatever it may be, you have a little bit of a reserve that you've already built up in your system.
And I like that analogy of the gym analogy approach of that it's a healthy process to help your body do what it's naturally designed to do, rather than just choosing a time where, all right, I'm going to stimulate your body to go into labor. It's more of helping it along to do what it's going to do at the time that it's right for you and your baby to birth the baby.
Yeah, exactly.
And so I think that's important too to understand, because there are people that have some fears around, like, well, if I go to acupuncture too early, it might start labor artificially too early in the body. And I think alleviating those kind of fears around it's not a process that you can artificially start your body to do something it's not ready to do.
Yes, that's definitely. And we also, if you go to a practitioner, they should be well versed in the points that you stay away from throughout pregnancy, the ones that we use towards the end of pregnancy when we want to get the baby out. So there are a series of points that we do not use until we're around 39, 40 weeks. And that's just, we call them contraindicated points for pregnancy. And that's because they're that effective when it does come to the time to actually want to get things going and get the body, ready to have the baby. So we just stay away from those points altogether. Not that, I'm sure that there hasn't been that many experiences of people putting people into early labor, but we just don't even touch them as a precaution.
Okay, so they're more reserved for like that kind of tipping point that the body might need to help the process along.
Yeah, exactly.
Okay. All right. Now, in the process of like working with a person, is a baby boost protocol like the same for every woman, or does it depend on what a woman's presenting with? I'm not really sure how that works.
Yeah, that's a really good question. So, in Chinese medicine, we have you fill out a very let me just tell you a little bit about like the diagnostic process. But when we meet with patients, when I meet with a patient, we have them fill out a very extensive questionnaire. I, ask a lot of questions about their history, their history pre-pregnancy, what their tendencies are, because not every pregnant woman is going to come in presenting the same. Some might have morning sickness, some might never have morning sickness. So we are all kind of constitutionally prone to certain things, whether we're pregnant, whether we're not pregnant. And those are all really important things for me to know as a practitioner, because we see every person as very individual and very specifically have a constitutional diagnosis. So, I don't know if that answers your question. I think I got lost in my train of thought, but
well, from what I heard you say, it does, like the baby boost, if it is a process we're talking about that helps labor along, like it's going to be the sequence of the points is going to be individualized, because one woman might have blockages or need help in one area of their body system, and another woman might need it in a totally different place based on their history, their presentation.
Yes, exactly. So, we always treat a woman in labor, pregnancy, where they're at with what their constitution is presenting, and then in addition, there are sort of these empirical points that are used for baby boost treatment as well. So, if you did any sort of Google search or research on it, you would see sort of these points used over and over and over again during pregnancy, throughout pregnancy, and then also, during a baby boost treatment. But again, as a practitioner of Chinese medicine, we are taught to see the individual as an individual and not sort of this set protocol that you come in and we just do the exact same thing that we would do with any other person. Does that make sense?
Yeah, definitely. And I think that lends itself to like the history that you're taking, but also the technology you're using to assess where a person is blocked and where it needs help. Can you talk more about that? Yeah.
So what's great is, so in my practice, we do a little bit something different. And it's called an Acugraph. And basically in school, it was my job to learn how energy flows in the body. So that's traditional Chinese medicine in a nutshell. I could go into lots of detail. And there's a meridian system, which is actually attached to organs and to emotional systems and all of that. And meridians used to be sort of this sort of imaginary thing before, and people were like, oh, it's, kind of woo-woo and all this. But what's great about technology these days is that they've actually been able to like inject dye and see where these meridian systems run, which is amazing. So the cool thing is that I studied Chinese medicine, traditional Chinese medicine. That was, it's been 10,000 years of this medicine, but I live in a time where modern Western medicine, has figured out a way that they can measure it. So, what it is basically is this system that I have. It measures the acupuncture points, and then I'm able to show you on a computer screen, a graphing system, and show you, oh, this is where you're a little bit deficient. This is where you're a little bit excess. This is where you are a little bit excessive on the right side or the left side, or imbalanced in those ways. And it shows me like a blueprint of what's going on right now in the body. So again, getting back to being very individualized, I can confirm with not only my diagnosis, not only my intake, not only my pulse taking and tongue diagnosis, but then I have this other confirmation system that's able to really see what's going on in the body. And it's kind of neat because it's a little bit unbiased. It is unbiased. It's not. It's a computer. So it's just looking at energy flow through the body, and patients love it. They are able to kind of get it. They get TCM really quickly. They get Chinese medicine really quickly, and they're like, oh, I see that. And then we're able to associate it. It's like, oh yeah, you have nausea and your spleen is a little bit, weak. So today we're going to focus on balancing that out so that you can feel less nauseous, that sort of thing. So it's really been a great tool that I've been using for probably like 6 months now. But I've really felt like it's added a lot to my treatments. I found that people have been having just quicker results from the use of it. And also just, the education part of it. It's really been great to kind of be able to show people how this medicine works. Because I know, but I've gone to school for, 5 years or longer to learn about it. So it's nice that people are like, oh, I get it. I get how it works. It's really simple. Like, you're deficient, you're excess. I can relate it to my own life. That sort of thing.
Right. And then clinically, I'm sure you can use it as an outcome assessment as well. Do you do rescans? Is it every visit, or do you do it like on a progress report? How do you do that?
So I can definitely do rescans, and I like to do them. I'll do one on our first visit, and then I wait a couple treatments, and then we do another one just to kind of see where we're at with improvement and all that. And then periodically we can do them. They take about 5 minutes to do, so it's not time consuming. And then you as a patient get a huge readout about what all of it means, and tips and diet recommendations and herb recommendations, and we come up with this whole plan for you. And it's been really, really, just really great, and people really love doing it, and I really love being able to use it as a tool. It's been really helpful for me.
Right. And I use very similar technology, well, in a nervous system sense, but I know as a practitioner, it's that objective information is really helpful. And especially kind of going back to Baby Boost, there's a time where you want to have as much information as possible to be able to help them as quickly as possible. And it sounds like this technology really kind of goes hand in hand with the wisdom that's been passed on for thousands of years. They marry really well together.
Yeah, I mean, I love that, technology has caught up to this medicine that is that old, because before, it sounds gruesome, I tell my patients this, but before, how the Chinese confirmed that these points were effective, or how the meridians existed, was they did these live autopsies. And that is awful. But they can figure out, like someone's alive and they put a point in here and they have an experience, somewhere else in their body. So while that obviously is very barbaric and we wouldn't do that, it's really great that now we have these imaging systems and the technology. And I love that there's this marrying of the two.
Right. And especially during pregnancy, it's such an important time for everything to be tip-top in your own body, because you're helping this baby grow, and then also for the delivery, because it makes such a big difference on mama's postpartum as well as, baby's start to the world.
Absolutely. Absolutely.
Now, with the baby boost, like going back to that, like when you mentioned it, I believe a little bit earlier, but I want to kind of recap like the recommendations of when is best for a woman to seek this type of care out.
So ideally, if I had my druthers, I would love to see people early in their pregnancy. So typically, my schedule with a pregnant mom is I see them from whenever they find out they're pregnant to 14 weeks. So a part of my practice is also fertility. So that's a usually easy transition. And then second trimester tends to be a little bit kind of easy breezy. Unless there's stuff cropping up, I usually see people about twice a month. And then I recommend that they come back at 32 weeks and we start getting the body prepped for delivery, whatever that may be, however they are choosing to do that. And a big component of that is, whether it's your first or third or fifth, pregnancy, it's still getting your mind in the right place is important. And sort of this byproduct of acupuncture, whether or not you're coming to see me for, back pain or fertility or whatever it may be, is that the brain actually goes into the same place that you are during meditation. So it turns off that sympathetic nervous system and allows you to really fully relax. So even if you're the type of person that's like, I can't relax, I don't know how to relax, sitting on the table for an hour will give you, probably a lasting effect of that for at least, the treatment, if not longer, which is really great. And then postpartum, I'm now recommending that moms come to me at 6 weeks. That's kind of the reason I picked that date is moms are usually taking some time off, and the husbands usually are taking some time off, or partners are taking time off for a period, and you're in this little bit of a honeymoon phase. And then partners go back to work and you're sort of like left with like being all alone. And sometimes that transition's fine and it's not a big deal. But usually when I see people around 6 weeks, we're able to kind of talk about how it's been going and address some of those things, balance out the hormones, get the mind back in a good place, help with breastfeeding if that's an issue. I mean, there's a lot of things that kind of crop up around that time. So I recommend for parents, but moms also to come around 6 weeks and come back and bring baby if they need to, and sort of get a reboosting treatment at that point.
Okay, that sounds good. Now, how is a person to get in touch with you best? Obviously, you can contact through the Cap Wellness Center, but how else can they get in touch with you?
Yeah. Obviously the Cap Wellness Center is a great way, and checking out our website. I also have my own website, just personal website that you can check out to learn more about me. And that's merinhiga.com. It's just my first and last name.com. And that would be probably the best way to get a hold of me.
Okay. And both of those websites I'll make sure are in the show notes for all of you listening, and it'll be on our website as well, the blog post that's dedicated to this episode as well. So you don't have to write it down now if you're driving in the car listening. But Maureen, thank you so much for sharing that information. I know that's something I was really wanting to bring you on to explain, because I get a lot of questions around like what exactly it is. And now we have a resource for people to understand it and seek you out for it. So thank you for your time. I appreciate it.
Of course. Thank you.
Thank you for joining us today. For more information about this episode and other natural childbirth and parenting topics, please visit us at capwellnesscenter.com or message us on our Facebook page with any questions you might have. We here at the Cap Wellness Center look forward to helping you and your family be as happy and healthy as you can be.